Okay, so we're good on Facebook. Good on YouTube. We're good on, should be good on Instagram now. Yeah, good on that too. Perfect. All right. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we are joined by Dr. Michael Frazis. Dr. Michael Frazis graduated in 2012, and he spent the first few years of his career focusing on patient communication and expanding his basic skill set. He now enjoys all aspects of dentistry with a particular interest in cosmetic work, complex surgery, and managing complex nervous patients. He is a frequent contributor to multiple online dental forums and is a lead educator globally for RipeGlobal. He has and is involved with teaching dentists from all ages in a variety of live and cloud-based courses from around the world. Dr. Michael Frazis, welcome to the show.
Thank you for having me, Lawrence.
So tell us about your CPD or dental journey and how that kind of developed into a special interest for cosmetic and complex dentistry.
Yeah, so I graduated in 2012, and I think I spent the first year doing as much free CPD as I could. So anything that you had $0 behind it, I was doing that. So I read some journal articles, did some things with the ADA, student societies, just anything that was free, because basically I was broke. From there, I decided that I didn't really enjoy not to say that it was bad quality, but I just didn't enjoy the lack of depth that some of those evening courses for a couple of hours would have gone into. And then I sort of branched out into some bigger courses. I lose track of what course I did when. I ended up in my early years doing like 120 hours of CPD a year, some years. So it started to get a little bit much, and I decided, well, I can't just do CPD on all aspects of dentistry. What do I actually like doing? And when I first graduated, I was like, you know what, I really want to be an oral surgeon. I really want to just, cut things open and stitch them back together again. And I really wanted to do surgery. And then the more CPD I did and the more courses I did, I think I ended up doing, did a course with, I don't remember what I did, but Tom Giblin was there, and I was speaking to him about wanting to do surgery and things like that, but that I really liked pros still. And I didn't want to give up surgery, and I didn't want to give up pros. And I was toyed with doing periodontics, because you can do surgery and implants with that, or doing oral surgery and all these different things. And he was like, well, I do a lot of surgery and I'm a pros. And I'm like, pros can do surgery? He's like, yeah, pros can do surgery. And I'm like, oh, maybe I want to be a pros then. So I started just doing a lot of prosthodontic-based courses and just learning a whole bunch of stuff with that, with the goal of getting into implants and surgery and things like that. So I started my CPD journey with not knowing where to go, and then sort of whittling down to, I want to do surgery and implants, and then realized I should probably get to it from a pros-based perspective, and then sort of made my stepping stones from there, doing lots of different pros-based courses and things like that. And then ultimately in the last 3 years, I've been devoting it to implants and that kind of stuff. So, yeah.
Right. Okay. So
early years.
So it was more of an interest than it was maybe what the practice was kind of building earlier on, you're saying?
Yeah. So it was more of an interest in sort of seeing where it took me. So, when we graduate in dentistry, we kind of don't know a lot about a lot of things. We kind of know just enough about everything to sort of be able to understand it. But then, just like when a doctor graduates, they know medicine, but then it's like, well, they can't do heart surgery straight up. They can't do this, they can't do that. They then have to specialize. But then before they specialize, they have to kind of do a little bit of everything until they figure out, you know what, I really don't like kidney surgery, or I don't like feet, so I'm going to go in this direction here. So it's the same thing in dentistry for me. I had to go, you know what, I don't really like, I'm not peds, I'm not ortho. Endo I'm fine with, but I don't want to do it all day. And then I was like, I like pros, I like surgery. How can I combine those two? And in the end, I was talking to Shravan, who I run courses with. I'm very close to him. For those of you who don't know, he's a prosthodontist in Adelaide. He was a few years above me at uni. And I was umming and ahhing whether I go and study pros at uni. And we were sitting down and figuring out, what do I want out of doing pros? And I was like, well, I just want to learn how to do pros stuff better. And he goes, okay, well, just learn how to do pros stuff better. And you don't need to go to study prosthodontics to learn how to do pros stuff better. You just have to do lots and lots and lots and lots of courses, rather than 3 years of your life at uni. You can do like 6, 10, 20 years worth of pros courses and things like that. Because at the end of the day, the only thing that I would get for me out of doing a pros course that would be different to, doing it on my own, other than structure and everything and the credentials and the title, is a lot of universities and some places will only let you teach if you have that degree or those extra titles after your name. And because all my teaching is and hopefully will be in the private sort of sector, it didn't really matter if I had a specialty degree after my name. So for what I was trying to do, it didn't make sense to drop everything, study pros for 3 years. I could just continue what I was doing and be what people call a super GP, where you just kind of do a bit of everything to a slightly higher level than someone who doesn't do a bit of everything. Not saying I'm better than other GPs, but I'm trying to do a lot of higher end pros work without becoming a prosthodontist, without all that sort of stuff like that. But I still have a prosthodontist in my corner that I refer to, so I'm not stealing things from the Pros Society. Yeah, I just really enjoyed that aspect of it, but I can't see myself focusing specifically in specializing or something like that.
Right. Okay. So basically, I'm just gonna rehash this. So basically, you graduated and you wanted to get more into these kind of aspects. You were doing CPD along the way in terms of oral surgery. You met people along the way that kind of you were talking to at these events. You were trying to gauge whether how do I kind of take my career a particular way that I want to go. Yeah. And then you came across Tom Gibland, who was like, well, maybe you can still, do prosthodontics work and still have that oral surgery element. And then you're talking to other colleagues that kind of, who was a specialist as well, that kind of gave you more of an idea of, well, is this really the right path for me?
Yeah, pretty much.
So I mean, whilst you're deciding all of this, and it's all coming at different points, how so you're working at the same time, right? And how you deciding your CPDs at this point? What are you picking to kind of get you to that next level and you developing your interest in that?
Yeah. So what I used to do and what I still try to do is at the beginning of the year, I would figure out whatever my time and money budget for CPD for that year would be, and then sort of whoever advertised early, I would sort of lock myself into a few courses, and they usually be the bigger things. I did some of the bigger ones that I did was so I was it was the first time that Jeff Coe ran his recent graduate conference. So I was at that one. That one was really good because he had all aspects of dentistry in it. Now he's segmented it into lots of individual components, but back then it was like a week long in I think the Gold Coast. I think it was at Versace Palazzo. I remember because we did the oral surge course and we were dissecting tongues and doing stitches, and they were on Versace plates. So I remember that really vividly. So yeah, there was that. There was basically anything that Lincoln Harris did. I was there. I did. Yeah, so it's lots of like bigger ones, like one sort of big one a year, and then I'd sort of do lots of little things here and there, and tend to do a lot of sort of more local ones, your ADA ones and things like that. And like, how did I pick it? Basically, I had the budget for it, and it looked interesting. I didn't do any of those ones that there was a period of time before COVID. I think they've kind of died off a little bit now. Whether they'll resurge, I don't know. But there was a lot of CPD that was very just for the tax deduction, I would feel. So those ones where I'm not, naming any names or anything like that, but those ones where you're like, I don't think this is actually going to give me any knowledge, but it would be a great networking event or something like that. So those ones I didn't do. Other ones I tended to do, but obviously the ones that I tended to do tended to come with higher costs. So I had to limit the ones that I could do. But I did manage to get around it, the cost factor, in a fun little way. So the way that I got around, because I did a lot, like when you do 120 hours of CPD a year, the cost adds up, and then you struggle to put food on the table and you can't eat. So I started to just help at CPD events. So in exchange for helping set up, moving tables around, or sometimes I'd take, the guest speaker out for lunch or dinner, or pick them up from the airport, or do this or do that.
Wow.
You get to, attend the lecture for free. But that was on the goodwill of the people who, ran those courses. And, if every single person tried to do that, there would be, chaos. But I was lucky enough that I was the only one doing it. And so, I was able to get a few courses at low or no cost, mainly because I was working at them. Because, that's how I...
Yeah, I'm going to come back to, like, when you were deciding to pick these courses, was it something that you were you were talking to colleagues and you're like, this sounds like a good course that I want to attend? Or was it like, look, I'm seeing things, comments online, reviews online, I'm like, this is the one I want to pick? Like, how did you decide? Because, like you said, they're not cheap, and you're investing a lot of money.
It was online, basically, because when I graduated was the start of your DPR and your sort of dental stuff in Australia, and it was mainly online. I didn't use any sort of magazine prints or anything like that. Sometimes I'd look at a flyer that would come out in the ADA magazine. I'd be like, oh yeah, that looks pretty interesting. But then I would ask colleagues about it. But if someone posted something up on DPR, all the people that I would be asking about it were there commenting on it already. So I didn't need to ask them, because they're like, oh yeah, I went to this course last year, it was pretty good, and this and that. So I'm like, oh, well, if this person went there and they found it good, it must be good, so I'm going to sign up, or I'll go talk to them about it or something like that. So it was all online. I'm from the generation where everything's online. So it was very little from print media. But if there was, it was, oh yeah, that looks good, and it would sit on my desk for a while, and until they put their ad online on DPR, and then I remember that one, it's on my desk, and then I sign up for it. But the fact that you've got the website with the CPD Junkie, and it's got the whole list of everything there, it's just great. I've flicked through it. I've gone, you know what? I need more courses in this. So again, you go look for those kind of courses, and like, oh, I didn't know that they did this one here, and we can go there and we can go there. So I didn't have that when I graduated. So something like that would have been very helpful, because then you can be like, you know what? I need to do more endo. I want a list of all the endo courses, and then you just get a list of all the endo courses, and then like, that one looks good. That's how I would have liked to do it, rather than first come, first serve, or whoever put their ad up on DPR. I'm like, sold, done.
Fair enough.
Yeah, there was no reason for it.
Fair enough. So, so you're attending these courses. You've mentioned you've you've got the whole week. Jeff Coe's one of the early big courses that you decide. Then you decide to do the Lincoln Harris one. Is this how you're progressing towards like this full mouth rehabilitation, prosthodontics kind of work? That's your wanting to get into?
So what I basically did was I decided to skip a few steps and then just go straight from, I'm 3 years out to let's do a full mouth rehab. So I signed up for Lincoln's full mouth rehab course. And at that point he was like, have you ever done a veneer before? And I was like, no, never done a veneer. And he goes, cool, you're about to do 12 of them. And I was like, yay. So then, I did some veneers. And like it all went well. The patients, like everything's literally still in there 6 or 7 years later, however long it's been now. So everything went well. But I think after that course, he told me, he goes, you're the least prepared person that I've ever sort of went through this course. And he goes, I should probably make some other like courses that would help people like you. And I was like, yeah, that would be very helpful. And then he created like all the other things. So I like to think that I helped him create what he's created now. But he would never admit that. But then, once after that, that was kind of eye-opening to like, actually, there's a lot that goes into these full mouth rehabs than just like, let's just put crowns everywhere. And then I sort of broke it down in my head and through talking with other people of, okay, I need to learn about, restorative dentistry really well. Okay, let's go do courses on restorative dentistry. Get that done. Cool, that's done. Or not done, but better than it was before. Okay, let's learn treatment planning. Let's learn, crown and bridge. Let's learn occlusion. Let's do this. Let's do that. And then sort of break down each of the things that I need to learn, the pieces of it, to do a full mouth rehab, and then go back and relearn how to do a full mouth rehab. And then the next time I sort of do it, it was a lot easier because I had all the pieces in my head. I just needed someone to help me put them together, rather than what I did at the beginning, which was just go there and you just have an empty head and you're like, fill me with knowledge. And they're like, you have too much space. There's not enough knowledge that it's too hard to cram.
You've got a small jar. I can't fit this all in.
Yeah. So I had to make my jar bigger by just sort of expanding lots of little jars everywhere. That's what I kind of did. And I just had my end goal still. I just had to work backwards from it, break it down into smaller chunks and then go from there. I mean, it's the same thing if someone wanted to do, endo. You just, do some smaller courses on endo. You might do some treatment planning stuff. You might do this, you might do that. You don't just go and, you can, but you have to go to university to do those bigger, more structured stuff. So if you want to do something structured, you can go to university, or you have to create the structure yourself, which is what I realized I had to do.
Well, what do you mean by you have to, as in like what you said, just like the four different... Yeah.
So instead of going, I want to learn full mouth rehabs, and then just like jumping, into the deep end of full mouth rehabs, and then I realized, I don't have the knowledge yet to do that. I can't do that. So then I had to break it down, create my own like curriculum where I go, okay, you first have to learn this, then you have to learn that, then you have to learn that, and then you have to learn that.
Well, then let's talk about
where I'm still at.
Yeah, let's talk about the fact that you jump straight in, right? And you take on a big case, and it's like veneers, like you said, and he's asking you, have you done any veneers? And you're like, not really. And then so as an associate, right? Like at a practice that might not be doing these big cases, you might be doing single units or whatnot, and then all of a sudden, how do you prepare for a case that's like, big case. And then how do you communicate that to the practice or like set up it's...
Yeah. That's a great question. When I signed up for that course, I was working at a practice where there was no way that I would be able to do the kind of dentistry I do now or wanted to do back then. For various different reasons, I ended up leaving that practice. One of them being I outgrew the practice. There was no way that practice would be able to become what I wanted it to be, or I'd be able to do the type of dentistry I wanted in that practice. There was just no way. So I outgrew that practice. I left. Luckily, I did sort of fall into the practice that I'm at now, and I can do the dentistry that I want to, and am doing the dentistry that I want to, at the practice that I am now. And what I did when I, got the job is I said to him, I said, look, I'm doing this full mouth rehab course. I already had the patient from the other practice that I brought over, and I got permission from the old owner. I said, look, this guy's part of my course. Can I actually steal him from you? He goes, yeah, that's fine. As long as you're just taking the one person, that's fine. So he came with me. He's followed me to the other practice, and I said, look, I'm doing this course. I'm flying him up. I'm paying for the lab fees. I'm doing everything. I just need, him to be seen here and all that kind of stuff. And he was very supportive. Dustin was very supportive with that and that journey, because at the end of the day, he knew that it would benefit him and the practice as well, for me to upskill. So if you got a good practice, it does help if the practice owner does do that work anyway. Like Dustin does do a lot of high-end stuff, a lot of rehabs and implants and things like that. So I'm sort of being mentored by him, even to this day, and just doing things following in his footsteps as it is. So if you aren't in a practice that you are capable of doing the work that you want to do in, then unless you own the practice, you can't change the practice. So I had to change practices and just leave because there was just no way I'd be able to do the dentistry that I wanted in that other practice. As to, finding patients and all that, the first few patients that I work on for any new skill or any new thing that I do, I always do, depends on what it is, but it tends to be like the first 2 or 3 tend to be completely for free. One, you have to talk with the owner regarding that, because obviously there's fees associated with stuff. So while the patient doesn't pay, you might have to pay the owner some money. And then it tends to be like a very discounted price. What I tell patients is the educational price, and I take like a lot of photos or video so that I can get feedback from people who are mentoring me in those skills. And then it's a reduced fee, and then I slowly, from the reduced fee, start increasing the fee to the fee that I want to charge, or the fee that the practice has set, or preferred provider fee, or whatever it's going to be. So it's never. So I find most patients are either going to say, no, I don't want you to do it, send me to someone who knows what they're doing, which is perfectly fine, or they say, you know what, I'm happy to be your guinea pig because you're not charging me any money. You still have to do a good job and have all the medical legal requirements and all that kind of stuff. But some patients are happy to do a procedure that they know they need, they just can't afford. So there's all those patients in every single practice. And then how you build a practice from there, doing those kind of more high-end stuff, it's taken me like nearly 10 years to get to the point where I am now, where I'm doing reasonably complex stuff on a reasonably just like weekly or bi-weekly, I'm doing something reasonably complex where I'm like, wow, where did this case come from? Those kind of cases. So whereas when I graduated or a couple of years out, I was like, I'm just doing DO fillings all day, every day. Whereas now it's like, oh, thank God I'm doing a DO filling today. It's a bit more refreshing. So
yeah, I mean, like,
sort of build up those stuff.
What's your thoughts on, when a dentist is doing it not as often as you? Like sometimes they get the odd case, and then it might be another 2 months or 3 months before they do another case. If they're not doing it as regularly, but they still kind of want to do it, like that's a tricky kind of situation, isn't it? Like.
Yeah, I mean, it depends on what it is. I mean, when I first did soft tissue grafting, I did 3 or 4 cases like back to back, and they all had various different levels. They all worked, but they all had some level of complication behind them, and it was just from an inexperience point of view. And I'd always take a lot of photos, get feedback from people who are mentoring me. It's always good to have a specialist that you know and like, that you refer to, that you can be like, hey, I'm learning this new procedure, can you just mentor me if I send you a few photos? And most of them are happy with it. And I kind of got a bit disheartened for a while, and I just stopped doing soft tissue work. I should have gone back and done a little bit more CPD on it. I don't know why I didn't. But then I wanted to start getting back into it. I did a lot more reading and a lot more research, and I did start doing a bit more CPD on it. But instead of just jumping in and just doing another case on an actual human being, I just went to the butcher and I just got I think it was a pig's head, and I just did some soft tissue. It's actually on my Facebook page, and it's just like soft tissue grafting on a pig's head. And then I just put it online and just said, this is me practicing. What do you think? And then just tagged like all these like surgeon-based people that I knew online, like, you know, Chris Ho, Tom Giblin, like all these prosthodontists and all these different people. And then like, you know, tell me what I did wrong. And then they gave me lots of tips. And from there I was like, oh, so that's why that didn't work, that other surgery. And then, so I was just practicing because I couldn't practice on humans. So I was like, well, I'm just going to practice on like a pig's head. And I used my old instruments from like dental school that I still had in the garage, and my old dissecting kit, and just use that. But or you can just buy like cheap instruments off eBay, and then like you can't use them on a patient because they're just going to break. So just get a pig's head and just practice. Or you can get a Frazis model online and just sort of practice doing some fillings and things like that.
I see.
Yeah, so you just practice and practice and practice. You don't have to practice on a human. You can practice like on your own time as well.
Yes.
Just like in dental school, like all the stuff that I do and all the stuff that I teach and all these things, they're not new. They're just what we did in dental school. It's just they make a lot more sense now when you've actually done a lot of, you know, work and hands-on things and seen patients. It all clicks a lot easier. And
yes.
Like I did my course last week, and we were in the sim clinic at the Adelaide Dental Uni, and it's like going back to the sim clinic, and you're like, it just helps because you're an actual dentist now. You've qualified, you've done all this, you know, training, all this work, and then you're going back to the sim clinic. You approach it differently than when you're a student. When you're a student, you're like playing around and you know, talking to your friend and, well, you know, what are you going to have for lunch and all that stuff. But when you go to the same sim clinic and practice with purpose, it makes all the difference. So I just, if I can't see a patient, or, you know, I don't have a patient until a couple of weeks later, I might just practice their technique, or, you know, do more research on it, or do this or do that. Like you can't just, you know, wait until the next patient comes up, because that might not come up for months, and then your skills get rusty.
I think that's a good tip. I guess you became good friends with the butcher, and your parents were probably wondering why we've got so many pig parts lying around.
Yeah, one thing I will tell you is make sure they don't give you a frozen pig's head. They take up a large amount of room in your fridge, and they take a very long time to defrost. They take about a week to defrost in your fridge. And this is in the height of summer as well, so you can't just leave it out because that will get very smelly. So make sure it's fresh, make sure it's not frozen, and make sure you have a big enough fridge, because there was a pig's head in my fridge for about a week, and I think she was my fiance at that time. She wasn't very happy.
They're like, Christmas is coming early. So, okay, so this is all happening. Now, where does the implant side of things start to come in now?
So implants took me a really long time to get into. I had a lot of self-doubt about getting into implant. I have no idea why. I did all other surgeries. I can remove, you know, wisdom teeth, do, you know, reasonably complex grafting and flap surgeries and things like that. But implants, like I was like, oh no, that's too scary. I can't do that. And I don't know who I was speaking to online. I kept asking them the same question like year after year. It's like, oh, what implant courses should I do? I'm a beginner. I got to do this. Do you think this? And at the end of the day, they said, Michael, just what are you doing? Just you do so much more complex stuff than implants. Just go do a course and then just start placing implants. It's like, oh no, it's too scary. I can't do it. And then like I signed up for ASID, and I just I did the first 2 modules, and I think I was one of like 2 or 3 people who were doing ASID that had never placed an implant before in their life. And everyone else is like, oh yeah, I've placed like 10 implants. I've placed like 3 implants. And I'm like, I've placed 0. And they're like, we've seen you online. We don't believe that you've placed no implants. I'm like, no, I've placed nothing. Like this one in the mannequin that I'm doing right now, that's my first implant, and it's in like a plastic bone. So yeah, so I had a lot of self-doubt for implants. I have no idea why I had self-doubt going into implants, because like implants compared to some of the other things I do, like the surgical aspect of it, as long as you're following the rules and have planned it all properly, isn't tremendously difficult. The tremendously difficult part is knowing where to place the implant, when to place the implant, and on who to place the implant. That's the complex thing, the treatment plan involved with it, getting the pros side of things correct. Anyone can put a screw into a bone, but if it's coming out the buckle of someone's cheek, well, it's not going to be of any use. But it's in there, so the surgery went well, but it's just not usable. So you got to learn all the other things first. And I spent like 8-9 years learning all the other things, and then stumbled at the last hurdle of the final piece, which was putting the screw in the bone. So I don't know why it took me that long to do it, but once it actually clicked in my head that I've done like all the hard bits of placing the implant already, I just need to learn like the actual surgery. I started going from there, and I haven't looked back since. I haven't placed a lot of implants. I've only done, I think, like 12 or 13 implants. But I've done twice as many implants this year as I did last year, which isn't very hard considering it was COVID last year. But yeah, so I'm well on my implant journey now, but I'm still taking baby steps because I'm very, very early on and getting a lot of mentoring with it as well.
Yeah, because I think that the way you've approached it is an interesting path, because you're going to come across cases where it might be like 3 missing teeth, and you've got a 5-arch bridge, and obviously ideally you would want something else in that case. And then to couple it, you did the soft tissue aspect first, because I think an aspect is that, as a lot of recent grads, they come out, they're like, I wanted to learn ortho, I don't want implants, I want to do it all straight away, and then they miss something that we're talking about here, which is that soft tissue aspect before the implant aspect. What are your thoughts on graduates rushing out being like, I want to learn all these things very quickly?
I'm in two minds about it, because it depends on the graduate. So I don't like giving broad sweeping statements that, and all that kind of stuff. But in my courses that I've done and run, I've met some graduates and I've met some undergraduates that are doing some of these courses, and they have their head like very well screwed on, and they know what they're doing. Their hand skills are like 1,000 times better than mine sort of were, because I had like atrocious hand skills when I graduated. And for them, I think it's fine if they're like, I want to do ortho. Great, go do one of those big ortho courses, start doing ortho, get the mentorship, get it all done. You want to do implants, do a big course, learn implants, great, start placing implants, get mentorship. I think where some people come undone is where they go, okay, I want to do ortho, implants, and rehab. So one weekend they do an implant course, another weekend they do an ortho course, and then the other weekend they do like a treatment planning or like a all-on-4 course, and then they start doing those bigger cases. And it's like, you did one day where 15% of the day was actually consuming food around the lunch table. So I don't know if you have enough knowledge to do these bigger cases on your own just yet. So it depends on how you approach it. If you approach it with, okay, I am going to devote my first year out to doing ortho, or my first 2 years out to doing ortho, great. Jump into ortho, spend 2 years learning ortho, then you can sort of do the next thing. Do the same with implants, do the same with pros, do the same with that, and then you can sort of work your way there. You can do the same thing by doing lots of little courses here and there, but it will take you longer to get proficient at one thing than if you just devote an entire 2 years on one aspect of something. uh, it's a lot, you get a lot more structure, a lot more sort of repetition, and you can sort of just focus on that one aspect. So if you're doing ortho, it's easy in 1 year to get a lot of ortho cases built up, and then for the next few years, all those ortho cases will continue, and you've got that sort of, you know, positive feedback coming into the clinic and all that kind of stuff. So your ortho career kicks off, and then you go, okay, well, I've done ortho, let's do implants. And then the ortho stuff is still happening in the background, but it's become kind of more automatic because you've been doing it for a while. And then you can add implants. If you try to do it all at the same time, you're either not going to learn anything on any of them, or you're just going to collapse under the sheer weight of the knowledge of everything that you need to learn. So it just depends on how you approach it. So I've seen some recent grads approach it the right way. I've seen some approach it the wrong way. So if you can do it the right way, I'd say go for it, but just make sure you're taking baby steps and don't do an all-on-4 case when you first graduate.
Right. So, I mean, you kind of alluded to this a little bit earlier. You know, there's a stage where in a lot of clinicians they start to contemplate practice ownership, being a specialist, being a super GP. You've kind of alluded to it, but there was a point, right, that you were considering maybe practice ownership as well. Would you say?
Look, I think practice ownership is always going to be at the back of my mind. I think in my early career, it was very front and center, mainly because I had bounced around between a few practices. There was nothing that I really liked. Everything was not set up the way that I would want to set it up. The way that I would want to set it up, or it wasn't run, you know, the right way, or this and that. And so I had it in my mind, you know, I have to, you know, go start my own clinic, or do this or do that. So back then, No wasn't running his practice ownership courses. So I just messaged him on Facebook. I think it was just like the first message I ever sent him. And I was like, hey, can I fly up to Brisbane? Or I think I was already up in Brisbane for something else, and just take you out for lunch, and, you know, just talk to you about, like, you know, buying this, and, you know, what you think I should do, and all that kind of stuff. And I knew Jeff Coe, and he is good friends with Jeff Coe. And we ended up having lunch together, and we spent like an hour and a half just talking about what I should do and all these different things, and found it very insightful. And from there, I started looking for practices, and I never quite settled on anything particular that I liked. I did, obviously I'm working at a good place now. And it's one of those things where the more I work at the current practice, the busier I get. The higher my billings are, which means that the kind of practice that I then need to purchase changes, because I've changed. So I can't buy something that's, you know, small and has no growth potential, because I've exceeded the growth potential that clinic already has. So what I needed changed so frequently, because I was kind of growing at an accelerated pace, that it was very difficult for me to find something that I wanted. Like, I was always looking. I think I'll do 3 or 4 sort of analysis of various practices every couple of months and things like that. But it just never, then, you know, you start a family, you get married, you settle down, and then priorities change a little bit. So at this point in time, I'm focusing on education, both my own and teaching. And then once all that sort of settles down, I'll revisit the practice ownership thing. So it's always in the background, but for me, it evolved to the point where, I outgrew the dream I had of practice ownership. First
and
time,
then so then did you decide to pivot and start something else?
So one of the ways that I did, I knew this was going to come up. One of the ways that I did start branching out, because it was like there was nothing in Adelaide that was interested me. So I was like, I always wanted things cosmetic wise, and this was back when the injectable craze was going through dentistry. So I was like, you know what, I'm going to buy a beauty salon, and then I'm going to convert it into a dental practice, and, you know, see what happens there, or convert it into something that I can use. But it just ended up being just, roadblock after roadblock. And I mean, if I bought a practice, if something breaks, or if the dentist is sick, or if the nurse can't do her job, or the receptionist can't do their job, I can step in and I can, help out. I can sterilize instruments. I can answer phones. I can do this 'cause I'm on premises. With a beauty clinic that I run remotely, I can't do that. I don't know how to do a mani-pedi. I don't know how to do a massage or a facial. So, you know, if someone was sick, then, between patients, I'm sitting there and like calling the other clients, being like, hey, this person's sick. You need to reschedule. And it just, it got a bit sort of hectic. And then there were other sort of financial and business issues with it that I should have realized before I purchased it. So in the end, I ended up liquidating it and accepting it as a very cheap way to get a MBA. So I consider it my my discounted MBA. I consider that.
But you actually have a diploma in business management, is that right?
Yeah, I do have a diploma in business management, but yeah, it doesn't help. There's one thing to have the credentials on paper. It's another thing to be able to run a business. I think that the thing that undid me is I was never there. So all the issues I had with the staff was because I wasn't physically present there, and I wasn't there from the beginning. So I couldn't put systems in place. I couldn't do this. I couldn't do that. And there was no way that could ever be changed. Like I was not going to sit there. I think I had a talk with Kinar once, and he was like, "Okay, how much money do you make at the salon in a week, and in a month?" He goes, "Okay, so that means in a week you make X number of dollars." It's like he asked me, "How long does it take you to make that money as a dentist?" And I'm like, "I don't know, a couple of hours." And he goes, "Okay, so for all this extra stress and stuff that you're doing, and all this extra finances that you're pumping into this thing, it's so you can work 2 hours less per week." And I'm like, "Yeah, that doesn't make any financial sense whatsoever." So in the end, I just had to cut it loose. It was a bad timing, bad decision, bad business, bad location. So.
And you felt, and so what you're saying is a diploma didn't help you see that, because some people would say, like, "Oh, look, I don't understand finances very well. I should go sign up for a business MBA course, and I would understand finance," because we don't get taught finances in dentistry.
No. I think the way that I approached learning that diploma probably wasn't as good, because it was something that I did to say that I did it, not because I wanted specifically to learn those things. I probably learnt more about business by having a business and then failing at it than I learnt in that sort of diploma. With other things like finance and things like that, I think these days, for those kind of things, there are a lot of, you don't have to go to TAFE or university. There's a lot of online based structured courses that you can do in business and finance. And I mean, if you're really cash strapped and you need to do something, then there's always YouTube is generally a good source for everything. But you just got to pick and choose who you listen to. It's just like in dentistry. I mean, you can get, let me see how I'm going to phrase this. You can do a let's use endo for example. So you can do a 3-year endo course to become an endodontist at uni, or you can spend 20 years doing small endo courses and focusing your career in endodontics. In the end, are you an endodontist? On paper, no, but you may have done the same amount of work to get there. It's just taken you a longer time and you don't have the title. You can do the same sort of thing with a lot of other sort of courses and stuff. You can do an MBA and pay a lot of money at the university, or you can do lots of smaller little courses and things like that along the way. But I think anyone who has done really, really well in business, I think they don't have a huge love of, going to uni and doing an MBA just because you want to get into business. If you want to get into business, just get into business. You don't have to do a course to go and do it. But yeah, if you want to learn, if you have a business and you need to learn more about finances, go do a bookkeeping course, or go do this, or ask your accountant where they do their CPD, and then go do the CPD that your accountant does. It's the same sort of thing.
Yeah. So I want to come back to CPD. So what particular CPD was a game changer for you, would you say, of all the ones that you've done?
All the ones that I've done. So number one would be Lincoln Harris's full mouth rehab course, because it just showed me how much is possible out there knowledge wise, but also how bad I am at dentistry, and how much further I have to go. And for me, it gave me the kick up the butt that I needed to just actually get the work done, and learn and grow. And before that, I did, it was the Jeff Coe's recent graduate conference, where I'm pretty sure it was a week long or something like that. And that was actually really, really good, because it was a week. It was, I can't remember how many of us were. I found the photo the other day. I should post it online. Of us, in the hallway, just all pointing at various things, and it's just got me pointing at a random different location in the thing. But it opened my eyes to lots of different things that could be done in dentistry that I didn't learn at uni. So a lot of the techniques that the oral surgeons were teaching us, we had the oral surgery module one day, then we had an endo module, we had a crown and bridge module, we had a treatment planning module. So we had lots of different modules, and they all just opened my eyes, I like this part of it, I like this, I like that, I like this. And then I think some other courses that were really pivotal for me, but in a different way. I did a weekend ortho course. I won't name who it was with, but it opened my eyes, but not in a good way. But it kind of made me realize, okay, I don't actually enjoy ortho, because I wasn't sure if I didn't like ortho because of the way it was taught at uni, or if I just really didn't like ortho, because maybe I just wasn't good at it. So I went to a course and I was like, actually, I have no interest in this subject whatsoever. I mean, I vaguely understand it. I'm not going to say that I understand it to the extent that other people would understand it, but I understand it enough to go, that's not for me to do, full time, or even sort of dabble with. So sometimes the best courses aren't the ones that you go, yeah, let's go do surgery, let's go do this. Sometimes it's like, you know what? I can now take that off the table, for my CPD journey. I will do enough ortho-based courses so that I can stay proficient with the treatment planning side of things, because that's obviously important. You still need to know how to I still learn how to treatment plan and all that, so that I can talk to the orthodontist when I'm referring to them, or various different things. But I don't have to do a lot of those courses because I'm not actively doing any orthodontics myself. So sometimes those courses are also quite good.
So, I mean, you've mentioned a few people that have been pivotal in your career, but, one thing that graduates want is mentoring, right? So people interpret that differently. Some people like to be held by the hand. Some people like to be checked in once in a while. Some people just want to be on the fly on the wall and just observe, What's your thoughts on recent graduates looking for mentoring?
I think you need to be upfront with yourself and with the person that you're approaching for mentorship as what you want out of it. When I graduated, I was told by one of the practices, or both practices that I worked at, that there'll be mentorship. And I was like, great, I've got mentorship. That's the buzzword that I was told I need to look for. I've got mentorship.
Tick.
The mentorship tick, income, tick, mentorship, tick, I'm winning life. But there was so my idea of mentorship was, let's sit down, I've got a case, let's go through it. I don't need you to hold my hand and go through every single case that I've ever done and ask me to explain it to you. But I also don't want you to just sit in your room and read a book and never actually, converse with me or anything like that. So I didn't get any I didn't get any mentorship that I wanted in those first places that I worked at, which was fine. I mean, I didn't do anything wrong, but I also didn't grow in any aspect. Like if I had a difficulty, I might talk to them afterwards, but it was like, oh yeah, maybe you should do this differently. And I was like, okay, I'll try that next time. And then I worked at another place, but the mentorship was more of a interrogation or a spying on you kind of mentorship, where it's like, okay, I read your notes after you saw that patient. Why did you use that technique, or why did you use that LA on that patient? And like, that because that's what I was taught, and this is the reason why I do this and this. I go, okay, well, we do it differently here. Like, but my way works fine. It's like, yeah, but I don't want you to use that technique. I want you to use my technique. But your technique goes against like the normal, status quo of what everyone does in dentistry. It's like, that's how we do it here, so I want you to do it that way. I mean, that's not mentorship. That's just, more
dictatorship,
dictatorship or bullying or something like that. So I think the mentorship kind of needs to be, one, what you want it to be. So if you want to sit down with your mentor on a weekly, bi-weekly, daily basis, be upfront about it, because some owners will say, I will do mentoring, but then won't do anything ever. Some people want their hand to be held. Because when I first started doing some bigger cases, I went to Dustin and I said, look, are you happy to come in maybe on your day off if I book this like implant, because of one of my first implants, and then just poke your head in and just sort of see how I'm going, and just be there in case something goes wrong. And he's like, more than happy to come in on my day off, just let me know what you need. That's good mentoring. That's what I wanted. I didn't want him in there holding my hand and doing that. Maybe I needed that a few years ago, but in these last few years I didn't need that. But I sit down with him. We go through a lot of cases. These days it tends to be each one of us in the practice, because there's 6 of us. We'll go to each other's rooms and be like, check out this case that I got. Yeah, look at this. But you can't wait to see what I'm doing with this one. And they're like, let's see what you're doing there. But we all are doing it to each other. So it's more of a friendship based mentoring thing that we kind of have, and we meet bi-monthly, and we go through some more complex cases, or there are cases that I'm stuck on, and I'll just bring them to my colleagues at work, and I'll be like, here are all the photos, because they have different experiences. They all have different mini specializations that they do. I'm like, what can you see that I can't see because I'm stuck? And then they'll say something and I'm like, aha, I didn't think of that. And then we sort of, go from there. So sometimes the mentoring is just, I'm stuck on this problem because I'm only looking at it from this angle. And I just get you to give me some feedback from this other angle. And I think we all need that at all times in our life. You can't just think, I'm 10 years out, I'm 20 years out, and I don't need to run my cases by anyone, or I don't need any mentorship, or I don't need to share this with anyone. We all need to approach dentistry as being a beginner, and having that small amount of, not self-doubt, but just curiosity as to, like, am I missing something? Maybe there's another way of doing this. Maybe I should do a little bit more research, or ask someone if they are thinking the same way as me, or does everyone kind of agree that this is a good way to go down? Yeah,
because that's interesting, because I can imagine a lot of associates sometimes are stuck in a situation where they might be the only clinician there. Even though it might be, multiple dentists at the practice per se, like they've got many associates, but they're on different days and you're the only one there. You don't have that ability to talk to other people and, see those kind of cases and how they kind of tackle things. And then, like you just said, sometimes it's about having that open communication with them and seeing if that matches you. Because I find that a lot of younger ones are very shy to kind of ask, and they're the type of mentoring, and then they get in this situation where it's like, that's not what I envisioned, and it's not what it ends up being. Yeah.
It's hard. It's hard.
Yeah. So I want to talk, talking about difficulties. Have there been any struggles in your CPD or dental journey so far that some of our viewers might not have known about?
God. Well, we know about the business side of things. That's out in the open now, although it wasn't a very closely guarded secret. Let me think. I mean, there's always, I've got cases that didn't go well, and patients that didn't like me, and there was one patient that had a few death threats from patients for various different things. They were all, the patient was a little bit their communication skills were not as good as they should have been, and they decided to voice their opinion with death threats rather than like a sensible human being. And I get those just like anyone else would get. So you get your difficult patients, your difficult cases, and things like that. I think one thing that a lot of people might not know is, so I was fired from a practice for a couple of years after I graduated. Mainly, it wasn't really I was fired for any particular reason. I feel, looking back, that I was moved on because the owner had a different vision for the practice that didn't involve me anymore, and they needed a way for me to leave really quickly. They started doing a few, when someone's moving you on because you start getting disciplinary meetings for very bizarre things, like, you were 1 minute late today. Why were you 1 minute late? It's like, I was out. I just walked in the door. Like, it's still fine. I'm here. And they're like, no, that's your first warning. I'm like, okay. Like, your patient got some sensitivity after their filling. I'm like, yeah, but I sorted it out and they're all fine. I was like, yeah, but they have sensitivity. That's warning too. And you're like, I can sense a pattern here. I think I'm not welcome here anymore. And then, things lead to that. And then, you get fired. So, but that led to a period, I think it was like 3 or 4 months, where I didn't have a job. I did some locum work for the practice I used to work at, because she didn't do any exos, and she hadn't done any exos since I left. So I was like, hey, are you okay if I come back and do some exos? So she would line up her exos on a Monday, and then I would just rock up on a Monday and then just sit there and just take out teeth and then go home, and that would make enough to cover like food and stuff for the next week, and go from there.
Yeah.
So I did that for 3 months, and then shadowed some specialists, and just kept applying for jobs, because when I lost my job, it was also the same time that I think it was in January, so everyone was also graduating. It was over Christmas and all that kind of stuff. So all the jobs were taken by the recent grads. So I was kind of like not lower down in the pecking order, but all the jobs were already taken. So I had to wait for the wave of recent grads to get cleared before I, found the job that I could apply to and stuff. And I found this one that I'm at now. So that's how I got there.
Well, then, I mean, at the end of it, I guess you could kind of say it kind of was a blessing in disguise, right?
It was a blessing in disguise. I mean, it worked out well, because I think it was a couple of months earlier, I went to it was the first CEREC Christmas party in New South Wales. Looking back to when we could travel, that was a great time. And I met lots and lots of dentists that I'm really close to and really good friends with. that Christmas party, and one of them was, Dustin. I ended up having like a slice of pizza with him at the casino at like 3 o'clock in the morning, and then we're just talking about just like random stuff. And then like 3-4 months later, I'm sitting in his office, and we're having an interview, and it didn't even feel like an interview. It just felt like we're just catching up and just like talking. And at the end of it, he's like, "Cool, you can come and observe me on Monday." And I was like, "Awesome." And I got the job. So I just walked in, and we just started talking like we were old friends, because we were old friends. We'd had pizza together a few months ago. So it was
at 3 a.m. in the morning.
3 a.m. in the morning. I mean, I've had pizza with like a lot of dentists at 3 a.m. in the morning. I remember I sat on the beach with Jeff Coe, and we had like pizza. It was like 3 or 2 o'clock in the morning. Yeah, I've had a lot of pizza with dentists at 3 o'clock in the morning. So must be a thing that I do.
I mean, is this the like little secret that is to how to get a job?
How to get a job
that no one tells you?
Yeah. Pizza, always pizza. Life is always about pizza.
So if you don't mind, I want to kind of come back to this little thing that you mentioned a little bit earlier. You talked about, this the situation where you had all these death threats kind of coming at you. If you don't mind me asking, like for when you haven't faced anything like that before, and you're an ethical dentist, you're trying to do all the right things. And you're being out for, a few years, or maybe even, we've had, guests as well where they've been out only for a year or two, and they kind of end up in this situation where it's like, how do I, like, what is going on? Like, can you talk to me about how you kind of get through that? Like, how did you kind of cope? How did you, manage?
Yeah.
Because,
That's a great point. And the only way I think I managed was, I mean, there were never actual physical death threats, because the person on the other end of the phone, so what it was a government voucher patient. There's a limit to how much treatment you're allowed to do on them, basically based on money. I did all the treatment, and one of the teeth that was left, because it was asymptomatic, happened to be the tooth that she really, really wanted to get fixed, but a lot of other teeth were giving her pain, so those were the priority, not the one that was asymptomatic and only aesthetic. And at the end of the treatment, she just goes back to the government clinic, and then they finish everything off. It's not like she's, without treatment, but for whatever reason, she decided that was enough for her to go off at me, because I didn't do the treatment that she wanted on the tooth that she wanted, because that was against the rules of the government scheme kind of thing. So it was more of a he said, she said kind of situation. And then when you try to explain that to the phone, then they hand it to their partner, and then their partner gives you, it was never a threat, but it was more like, if I happened to be at the same place at the same time as you, it would be very interesting if something happened to you, kind of wink, wink, nudge, nudge. So I did get the police involved, and they weren't able to do anything because there wasn't any direct sort of threat, but they were very happy that I did speak to them. So the first thing I'd say is, if you are having actual threats against you, your person, your friend, your family, your workplace, do let the police know. Even if they won't do anything about it, it does add a flag onto that person's file. That may be the tipping point that the police need to do something, or to investigate something else, or they might also go and do it to someone else, because these people like this don't tend to just do it just to you. They'll do it to a lot of other people as well. And if they have multiple things on their file, then it adds up a lot quicker than if no one ever says anything. It's the same thing with if you suspect that your child patient is being abused, or if an elderly patient is being neglected, your voice can be the thing that makes a big difference. Even if you don't think it will, it can make a big difference. And then I would speak to my wife. She was my fiance at that point, but I'll speak to my fiance. I spoke to the practice manager, to the practice owner, to various different people, and just sort of get my story out there. And then they would be like, yeah, well, you did the right thing. It's not you, it's them. And basically, like you said, because I try to be an ethical dentist doing the right thing. When someone attacks that, you start to have some self-doubt as maybe they are right. Maybe I didn't do the right thing. And you start looking back and, you go through your notes and you're like, did I do the right thing? Did I say this? Did I say that? But then you speak to these other people who, they know you, and then they can sort of bring you back to that sort of place of calm, and then go, you know what, I might have been listening a little bit too much into this other person who doesn't know me. They've known me for such a short amount of time. Their opinion of me doesn't reflect who I actually am, because they've known me for a microsecond of time in my entire lifetime, whereas your friends, your family, your parents, your colleagues, they know you for so much more, and they can get a better gauge of who you are. So if your partner, if your mum, if your boss is saying, I have no problems with you, you are perfectly capable and fine, then maybe they're right, and not this random person who's just coming off the street and just sort of yelling abuses, you. That's more a reflection on them and their life than it is on you and your life. So I find talking, and obviously if you don't have people around you to talk to, or if you struggle to talk to those people, then having a professional person to talk to as well can help. I didn't get to that point, but there are other points in my life where that might have been, beneficial, partners breaking up, or, family members passing away, where talking to a specialist might help out. So a psychiatrist, a psychologist, or whatever you sort of need, or even your GP, just say, look, I'm struggling a little bit with something. Do you think you can just sort of listen to me? And some people just, need someone to hear what they have to say.
Yeah, because if you haven't experienced anything like that, you're bound to come across it at some point, when a patient when they're just not happy, and they're just calling you a shit dentist, and but in that moment, it's kind of confronting when you're faced with it for the first time.
It is.
Yeah. So, just to kind of wrap things up, what piece of advice would you give to your younger self, if you could?
I was actually thinking about this the other day, because I'm only, I'm 31, so I am by no means old. So a lot of older dentists would be like, he's just a baby, and a lot of younger dentists would be like, he's old. He's like 31's like super old, especially if you've recently graduated. But it's looking back on everything that I've done, everything that I've achieved, everything that I'm doing. It's really hard to look back and put myself in the shoes where I was back then, and see where all the pieces would end up falling into place, and create the person that I am today. So the advice would be, it's a journey, and you just have to just keep going at it. Like every little bit and piece will fit into a bigger jigsaw puzzle in the end. You might not know what that bigger jigsaw puzzle is an image of, but it will get there. You'll get there in the end, and you just got to do it piece by piece, slowly. Just do the little building blocks and have that image in your head of what you want the end to look like, and then just keep putting the little blocks in place. And in the end, if you keep doing that, you have the finished picture in a few years' time. Like, the time will pass, so you might as well do something with it and enjoy the ride as you're going along.
Fair enough. That's some wise words from the top 10 dentists in South Australia in 2020, hey?
Yeah, number seven.
Dr. Michael Frazis, thank you for coming on the show. There's so many more questions I wanted to ask you. Can you let the people know how they can find you?
Yeah, so you can find me on Facebook and Instagram. If you just search Dr. Michael Frazis, you will find me there. I've got webpage and all that linked on my Instagram, and all my stuff is on RipeGlobal as well. So we can.
Awesome. We'll definitely leave in the show notes below.
We will.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.